Are you one of those persons who pop gas medicine after each meal and feel relieved for a short period of time? You may not be aware of that you might be having lots of health related risk involved because you are taking the medicines, gas medicines every day. As a cardiologist, I have seen innumerable number of my patients who are consuming gas medicines on their own without any prescription for years and decades together, and this gas medicine intake jeopardizes their health. In today's video, we'll discuss only about that. So whenever I ask patients why they are taking gas medicines, they have lots of explanation for that. Most common explanation is that, doctor, I'm taking lots of medicines. I'm taking medicine for blood pressure. I'm taking blood pressure from medicines for the cholesterol. I'm taking medicines for the diabetes and few other medicines as well. Since I'm taking lots of medicines, isn't it required for me to consume the gas medicine always? So that is the number one query, that since they are taking having polypharmacy, they need to take the gas medicine along with that. Second explanation usually what they give is that they tend to have whatever pain they have. They might have a headache, they might have a upper back pain or lower back pain. Any pain they associated with gas and acidity, and any pain they consume the gas medicines. Few of the patients as well tell that if they do not take gas medicines, they do not feel good. It is something like an alcoholic who is consuming alcohol. A person who is addicted to alcohol, if he doesn't consume alcohol, he doesn't feel good because he gets addicted to alcohol. He gets a withdrawal symptom because if he doesn't take alcohol. Same way, the gas medicine, those people who are taking for years together, they're addicted to gas medicine. So if they do not take gas medicine, they do not feel good because otherwise they'll get the withdrawal symptom. Likewise, alcohol is not good for health. Same way, the long-term use of gas medicine, although the patients feel they do not feel good, but that's not good for them. Ultimately, it's causing them harm, which they are not understanding. And fourth, there are few digestive issues, which might be because of something else. They might have consumed some food, they might have some gastrointestinal infection, colitis or something like that, and because of that, they are taking the gas medicines. And once they have started the gas medicine, they have continued. So these are the few explanations usually patients give when they are consuming the gas medicines for years together. Gas medicines, they are powerful, they are effective, but there are indications for the usage of gas medicines. It's not that they need to consume for years on altogether, because these gas medicines are quite strong, they are powerful, but they are habit forming also. And usually doctors and patients, both of them, they overuse the gas medicines. So in today's video, we would question, the two key questions are whether these gas medicines, they are chronically required or indicated, and second, in the long run, whether they are safe or not. So regarding the uses of gas medicines, the uses of gas medicines are only for short term. No studies have shown the gas medicine should be continued for years or decades together, because there are some specific indication for which in gas medicines, or what they are known as PPI, that is proton pump inhibitor, like any drugs like pantoprazole or lansoprazole or omeprazole, anything which ends with zole, omeprazole. So these are known as proton pump inhibitor, and they are used for specific indication like H. pylori infection. So H. pylori is a bacteria which is present in the stomach, and they can cause various health related complications including gastric ulcer and gastric cancers as well in the long run. So if the doctor has detected an H. pylori in your stomach, and in a part of that treatment, gas medicine or PPI is prescribed, but that is for short duration. Same way, acute gastritis, and if there is some gastric ulcer, either stomach ulcer or duodenal ulcer, to heal the ulcer, the proton pump inhibitor or gas medicine, gas tablets are given for at least 4 to 8 weeks. But these are the proven indication where a doctor has done a test, especially endoscopy, and found out there is an ulceration in the stomach or in the duodenum, or there is an active gastritis, or there is an active H. pylori infection. In those type of indication, you need to take this gas medicine, and that too for a short duration of time. But most of the time it doesn't happen like that. And how this proton pump inhibitor or gas medicine work? They work by decreasing a pump which is known as proton pump. Proton pump is something like a water pump. The water pump pumps the water. Likewise, there is a proton pump which is present in the stomach, which pumps or secretes the acid or hydrochloric acid in the stomach. And this drug, this powerful drug, which is known as proton pump inhibitor, like pantoprazole, omeprazole, or lansoprazole, or rabeprazole, they inhibit this pump for 24 hours, and thereby they decrease the rate of acid secretion in the stomach substantially. So we have discussed about the role of proton pump inhibitor in diseases like H. pylori infection, like acute gastritis, or stomach ulcer, duodenal ulcer for a short duration of therapy. But most of the time they are consumed both by the patients as well as they are being written by the doctor for long period of time, for decades together. And because of this, there are lots of complications which can happen because of the prolonged usage of this type of powerful medications. There could be a nutritional deficiency because of the prolonged intake of these medicines. There could be bone health issues. There could be a risk of infection. Even there are risk of gastric cancers as well, along with cardiovascular and kidney related problems. So we'll discuss about all this one by one. So if you consume the proton pump inhibitor or gas medicine for a long period of time, there are some nutritional deficiencies which can happen. Out of that, B12 deficiencies could happen because B12, especially which is found in the animal product, they are bound with various proteins in the food. And this B12 along with this protein, when it reaches the stomach acid helps in liberating B12 from the protein, and thereby vitamin B12 gets absorbed from the lower part of the GI tract. But if you take proton pump inhibitor or gas medicine for a long period of time, our hydrochloric acid in the stomach or acid in the stomach comes down. Thereby vitamin B12 doesn't get absorbed. So consequently, a person can develop B12 deficiency, and B12 deficiency can have varied symptoms. The patient can have anemia because of B12 deficiency. Patient can have even neurological problem, dementia, because of B12 deficiency. So B12 deficiency is a common accompaniment if somebody is taking long-term PPI. Second is magnesium deficiency, because magnesium absorption also is dependent on the acid in the stomach. So magnesium has multiple roles. Magnesium has a role for the muscle metabolism, so you can get cramps. Magnesium has a role in cardiovascular health, so chances of developing an irregular heart rate increases if there is a magnesium deficiency. Magnesium also has a role in sugar control. So magnesium deficiency can have lots of health related issues. Iron also can be deficient if a person is already continuously on a gas medicine, because for the iron to be absorbed in the form that is known as ferrous form, that it is required, that stomach acid is required. And because of the lack of stomach acid, because of persistent intake of proton pump inhibitor, there is iron deficiency as well as there is increased risk of calcium and vitamin D deficiency. So these are the nutritional deficiencies which happens because somebody is on a long-term proton pump inhibitor drug or gas medicine. So along with the nutritional deficiencies, there are increased risk of infections also, because our stomach is the first line of defense against infection, because stomach has very high degree of hydrochloric acid, which is a very low pH. So whenever we are taking food, the food contains various pathogens, be it bacteria, be it viruses. So whenever it goes inside the stomach, it cannot survive that high acid content in the stomach. So once we are eliminating this acid in our stomach by continuously taking a proton pump drug or gas medicine, this pathogen which we ingest in our food, they can proliferate in our gut. So by proliferating in our gut, there could be various life-threatening infection also, like Clostridium difficile infection, which can cause life-threatening sometimes enterocolitis. There can be bacterial overgrowth in the small intestine. So these are all few life-threatening conditions also which can happen because of persistent intake of a gas medicine. Likewise, fungal risk infection also increases quite significantly, and the risk of pneumonia, the research has shown up to 27 to 30% risk of pneumonia increases if somebody is on a persistent proton pump inhibitor or gas medicine. So along with the nutritional deficiency, the risk of various infection, in fact few life-threatening infection also increases significantly if a person is on a persistent gas medicine for no reason. So likewise, there are some bone health issues also, because our calcium and vitamin D absorption also is hampered when we decrease our stomach acid. So the risk of fracture increases subsequently because of our persistent intake of these medicines. So as you can see, there are lots of problems which can happen because we are taking these medicines. There could be nutritional deficiencies, there could be risk of infection, there could be risk of bone fractures, and not to mention of kidney ailment, because persistent intake of these medicines can have kidney ailments also. And this kidney ailment could be acute kidney ailment. Acutely, a person might be totally normal, but because he's taking this drug for a long period of time, even after a few months intake of this gas medicine can cause a condition known as acute interstitial nephritis. So that can cause an acute kidney failure. And persistent intake of this drug also precipitates or aggravates chronic kidney disease. Suppose a person is having a kidney disease which is not severe, which is mild degree of kidney disease. Maybe creatinine is borderlinely elevated, but he is persistently on this gas medicine. This gas medicine has the capability to progress the kidney disease further, so to make it worsen. So it can precipitate acute kidney failure because of acute interstitial nephritis, as well as it can aggravate the already existing kidney diseases. So if you want to have a healthy kidney, better not to take this medicine without any prescription, and that too for years together. There should be always an indication to have this medicines. And there are some other important consideration also while having this medicine. There could be lots of other problems, like there could be a risk of dementia because of B12 deficiency, even heart disease risk also increases significantly if the person is all consistently on these medicines, because magnesium deficiency, and magnesium has a role in the protective effect on the heart. And not to say persistent intake of this gas medicine alters our gut bacteria. Our gut bacteria, as we have discussed previously, has good bacteria, has bad bacteria. If there is more good bacteria, is beneficial for our health. If there are more bad bacteria, is not beneficial for our health. So good bacteria, they thrive on fiber, while bad bacteria, they thrive on sugar and processed food. And at the same time, if you are continuously consuming gas medicine, it helps in the growth of bad bacteria in our gut, which can have various health consequences. So these are the list of side effects which had been listed on PubMed. So PubMed is a medical journal where they publish various studies, and from those studies you can see from this chart, these studies were conducted over a period of 4 years from 2021 to 2024, and they have found out these are the adverse effects of persistent use of gas medicines. As we have discussed, it could lead on to nutritional deficiencies, it can lead on to various risk of infection, including life-threatening infection. It can cause bone-related problem like fracture. It can cause heart-related problem, can cause nutritional deficiencies, dementia. Even some cases, it can lead on to gastric cancer also. So these are all the risk factors or adverse effects of persistently taking a gas medicine over a long period of time without any supervision. So if you are taking this gas medicine for a long period of time, be mindful. You might be having any of these adverse effects. So gas medicines not only causes all these side effects over a long period of time, but they also have an impact on your pocket, because most of the time these gas medicines are not inexpensive. In fact, few of the gas medicines are quite expensive, and it is commonly seen that patients usually think that the more expensive the gas medicine is better for them. They have this sort of tendency to think. In fact, it could put a severe drain in their pocket by taking these gas medicines which are costly, which are not indicated. And it's not only indicated, it is outright dangerous for them in the long run. And ultimately, because they're taking this medicine for a long period of time, they're becoming dependent on them. And if you take off from this medicine, they get an withdrawal symptom. It is something like an alcohol or a smoker who gets accustomed to that alcohol or smoke, so that they are dependent on that for their well-being. And if you take off these medicines from them, they get the withdrawal symptom, and once again they restart their medicines. So you should have a policy where we can take off these medicines from them by using these medicines on demand. So many times patients take it just like they feel good by taking these medicines. So that is not an indication to continue this medicine. So if you have some problem, as and when required, you can take it on demand basis rather than taking continuously. And you should always have a regular follow-up with your doctor, and you should consider some alternative rather than taking this powerful PPIs or proton pump inhibitor as they are known as. You can take some alternative medicine, like you can take some antacids. There are various safer antacids which are available, like alginates. You can make use of sodium alginate, you can make use of other antacids, you can make use of H2 receptor blocker. These are much cheaper and they are not that potent, so they won't cause that much of problem problem. So you can have this alternate form of therapy. So if you like our content, kindly subscribe to our channel and press on the bell icon, and kindly share with somebody else for which it could be beneficial. And please comment to let us know how you are finding the content and what all contents you want to listen in future videos. So how do we take off the patients from a long-term PPI use? Since we have known this long-term PPI use could be detrimental for our health, could be dangerous for our health. So first and foremost is that we can ask them to have a gradual tapering, because some of the patients, they are taking double the dose. The morning one PPI they are taking, the evening one PPI they are taking double the dose in the morning. So you can ask them to gradually decrease the dose of this PPI or proton pump inhibitor. From maybe twice a day, you can come to once a day. You can decrease the dose of the medicine by half, from twice a day to once a day. Then probably every alternate day you can take, every 3 days you can take. Slowly you should try to taper them off, because if you ask them to discontinue suddenly, there will be withdrawal and they will be restarting the medicine once again on their own. So gradual slow reduction of this PPIs, dose by dose. As well as you can give some bridge therapy like other medicines of what we have discussed. You can give some antacids like alginates, you can give other type of antacids, you can give H2 receptor blockers. And last but not the least, most important is that follow lifestyle modification, because these medicines are to be used only for short duration of therapy, and they do not address the main reason behind the patient's discomfort or gas symptoms. So the main reason behind the patient is having this problem can only be tackled by a lifestyle modification or dietary modification. So you should advise the patient to have a good healthy lifestyle as well as dietary modification. So in this healthy lifestyle, the most important is the diet. Diet, especially the timing of the food, is very important. Ask the patient not to have the dinner very late, because if somebody takes a late dinner, the chances of developing a gastritis or GERD or reflux or gas or dyspepsia or bloating increases significantly. So there should be at least 3 hours gap between your dinner and bedtime. So if you do not follow this, there are chances of getting all these GI symptoms or gastrointestinal symptoms. So timing of the food is very important. Then what type of food you are taking. Avoid hot and spicy food, because hot and spicy foods tends to increase the GI symptoms. As well as you should avoid various citrus fruits if you are having an active gastritic symptoms. Like you should avoid lime, you should avoid oranges, then you should avoid various acidic food like cold drink, colas, sodas and all. As well as you should avoid various two things which are very common, which people use it and they commonly cause GI symptoms. One is milk, because most of us are milk intolerant, lactose intolerant. So if you consume milk and you have some gas issues, you tend to think that you are having gas. Actually, we are lactose intolerance. So avoid milk if you are having this GI symptoms, and avoid gluten. So most of us are gluten sensitive also. So gluten is found in various substances, like it is found in wheat products like atta or maida or dalia, or sometimes barley, rye, even in sometimes oats also the gluten is found. So if you are gluten sensitive, if you are having frequent GI symptoms, avoid gluten, avoid milk based product, especially milk, and avoid various spicy food as well as citrus fruits. And you can take alkaline fruits rather if you have this as active gastritic problem. Alkaline fruits like guava, pineapple, pears, avocado, all these things you can take. And sleep is also very important, because if your sleep is not proper, if your stress level also is more, you tend to have more GI symptoms. And especially sleep on the left side, because if you sleep on the left side, it decreases the risk of gastritis significantly. So timing is important. What type of food you should take, that is important. How would you sleep, how to decrease the stress, all these things are also important. And avoid bad habits like smoking and drinking, because smoking and drinking along with the fried foods increases the fried and crispy food increases the risk of gastritic symptoms significantly. So to take off the patient from an addiction of a proton pump inhibitor or gas medicine, a lifestyle modification is very important, because if you follow the lifestyle modification, most of the time medicines won't be required. So how to take off the patients from the addiction of a PPI? You should tell them what are the long-term risk of or long-term taking of these gas medicines. One, because most of the patients, they are not aware of these gas medicines could be very, very harmful for them, and you should ask them to gradually decrease the dose of gas medicines from, maybe some people are taking twice a day, from that make it once a day, cut the dose by half, then make it every alternate day, and you should have a bridge therapy. Give some less expensive and less potent medicines like antacids, alginates, or H2 receptor blocker like cimetidine or famotidine. And last but not the least is lifestyle modification, because lifestyle modification, if you do not follow, then once again you will have rebound of the symptom and you will continue taking these medicines. So lifestyle is very, very important. So if you like our video, kindly share our video with somebody else, and you follow this video for a detailed analysis of how to take care of your gas and acidity.